Can I have a Pellevé RF session and immediately afterwards get a microdermabrasion?
Thank you for your question. You're asking that whether or not you can get a Pelleve RF session and then immediately have a microdermabrasion. So I think that we have to understand exactly what is the intended goal or purpose of these treatments so that you can understand whether or not it's appropriate. I've been using Pellevé for many years, radiofrequency technology, and just to go over some basic principles of Pellevé and the concept of radiofrequency. First of all, what we're trying to do with Pellevé is we're trying to stimulate collagen by generating a certain amount of critical temperature that initiates a collagen response by the skin. There's also another part of Pellevé where you are actually almost restructuring the skin by getting it to a certain temperature and then massaging it or stretching it to allow almost like a realignment of collagen. Now, of course, all of these responses depend a lot on the intrinsic ability of the skin to actually respond to the radiofrequency. Essentially, this is treating skin at the dermis level, the layer below the epidermis. And this is where the support of the skin is. And so when people start getting wrinkles or the skin gets thinner, it's dermis, the collagen in the dermis, that diminishes. Now, microdermabrasion is really about taking off the top layer of the epidermis, the layer called the stratum corneum, which the purpose of that, of microdermabrasion, of course, does contribute to the improvement of fine lines and wrinkles as well as superficial skin discolorations, but it's to get rid of a lot of the dead skin on top of the skin. Now, in our practice, when we do a Pellevé treatment like that, we generally don't tell patients that it's okay to have a microdermabrasion immediately after. I think technically it's probably acceptable, but you have to think about the aggressiveness of the microdermabrasion. Microdermabrasion can be very mild or it can be very strong. In fact, in our practice, we do something that has become a very popular and it's actually, for all intents and purposes, has displaced microdermabrasion. We use something called hydrofacial. Hydrofacial is a device and technology that uses water, like the crystals in a microdermabrasion machine, and with it comes the infusion of water, hyaluronic acid, glycolic acids, and it's been very much more comfortable for our patients to get that treatment, and they get this very nice glow after the hydrofacial that is unique to this treatment. So if the convenience is a factor, well, then you may want to go lighter on the microdermabrasion, but otherwise I would say do these on separate occasions. I think that when you heat up the skin properly with radiofrequency, you don't want to disturb it too much. There's now this stimulation of the collagen response, and the skin can only tolerate so much trauma before you're actually compromising its ability to generate. It's almost like, if you want to use an analogy to working out, it's like overtraining. So consider that and discuss this with your doctor as to what the desired outcomes are, and maybe there's an efficient way to do this so that you don't have to make more than one trip. But if you really want to be aggressive with both, then probably you'll want to do these procedures on two separate occasions. So I hope that was helpful. I wish you the best of luck, and thank you for your question.